Tonight on Medical Rounds, you may notice when you're out trick-or-treating that some purple pumpkins are around, and it's meant to grab your attention for a not-so-spooky reason. It's to raise awareness for people living with epilepsy. Nearly 60,000 people in Connecticut live with epilepsy every day. And joining us now from Hartford Hospital to talk more about that is Dr. Gabriel Martz, director of the Epilepsy Center at the Hartford Healthcare Ayer Neuroscience Institute. And we thank you so much for being with us tonight, Dr. Martz.
It's my pleasure. Thanks for having me.
Well, it's great to have you. And we're going to start first by asking about the purple pumpkin. We understand it was started right here in Connecticut. And other than raising awareness, what is the goal?
Well, the Epilepsy Foundation started the Purple Pumpkin to trigger discussions and increase understanding. The idea being that if you're talking to someone about their loved one with epilepsy or that they have epilepsy, we start to understand that while seizures can be scary, we don't need to be scared of people with seizures or epilepsy.
Oh, that's a good point to make. And let's talk about epilepsy in general. What is it and how is it diagnosed?
Epilepsy means having recurrent seizures that aren't caused by anything else, just by the epilepsy itself. We diagnose that by taking a very careful history, speaking to the patient at length to understand what kind of experiences they have during a seizure, what their family members may have witnessed during a seizure, and how that's impacting their life. We diagnose it, in addition, by using EEG or MRI, other kinds of tests that help us to narrow down on the exact kind of epilepsy that someone might be experiencing.
And I imagine it would be so helpful to be able to see a seizure as it's happening. And I know at Hartford Hospital you do have a 24-hour monitoring unit. How does that help treat patients?
Yeah, that's exactly right. In some cases, we aren't certain that what a patient is describing to us is in fact a seizure. In other cases, we're certain that it's a seizure, but it's very hard to get the seizures controlled, to get them to stop having the seizures. So by putting someone in the epilepsy monitoring unit, we can see their seizures. It's a specially designed unit in Hartford Hospital with very nice single occupancy rooms where we can monitor people on continuous video and EEG, and we allow them to have their seizures in a very safe environment where the nurses and the techs that are there are well trained to take care of people having seizures, and it allows us to really understand what the patient's experiencing. By knowing the kind of seizure they're having, where in the brain that might be starting, we can get a much better sense of which treatments might really be helpful to control their seizures.
That is great to hear. You're getting right to the root of the problem. And we thank you so much for being on our program tonight, Dr. Martz. And if you at home would like to learn more about epilepsy, call the number you see on the screen right now. And if you'd like to chat with Dr. Martz, he's very knowledgeable, as you just saw. He'll be having a live Facebook discussion on the Hartford Healthcare Facebook page.